Hi guys. So I got done with my second chemotherapy session, and it was a little better than before. The side effects were a little normal, I mean, less than what I had in the first go. But then I had a lot of hair fall these few days. So I had my chemo on the second and the third. I was supposed to get a port done, but unfortunately the surgeon wasn't there. It's a surgical procedure, so the surgeon wasn't available. So probably the next time I go for it, I'm gonna get a port done beforehand. And talking about my nerves, they have become all blue and red on this hand, and I have some clots on this hand. If you can see, there is a little here, and I've started getting red spots, like red dots, like on my skin. So these are the signs of nerve damaging, and I don't want to do chemo through my nerves anymore. I want to do it through a port because I'm feeling the change on the texture of my skin and the swelling and the clots. So I'm gonna have to take care of that. Talking about food, uh, last few days I had a lot of gastritis pains and pancreatic pains, but since yesterday I'm feeling a little better. I'm having a lot of lukewarm water with lemon, at least 2 glasses in a day, and it's helping me cleanse my stomach. I don't want to go for laxatives. So the previous chemo I had loose motion problem, and in this chemo I had loose motions on the first day, and from the second day I only have constipation problem, which is increasing gas in my stomach. So I am taking care of my food. I'm eating every 3 4 hours, and I'm not eating stomach full. I'm eating smaller meals, and I'm eating a lot of roughage so that it cleanses my system. But the challenge with roughage is it also creates a lot of gas, so I have to do a little bit of movement. I'm doing certain yogasans to ensure that I'm passing out gas on time, and I'm not feeling that pain. A couple of days I had to have tablets for vomiting sensation, nausea, and gas, and stomach pain. So after 2 or 3 days I stopped taking the medication, and since last couple of days I'm eating and I'm walking a little bit. I'm not totally like sorted, but then I am doing okay. Like if I'm doing something else, my mind doesn't go back to my stomach. So that's the state that I'm in. And in food, I'm having salads. So I have decided how I want to go about my food, because first chemo was so confusing. So by second chemo, I know what I need to eat. So first meal, I'm eating like breads like chapati or roti, or some toast with a peppermint tea or a lemongrass tea, or you know lemon ginger tea, lemon tulsi tea. So I'm having these kind of teas with a couple of toasts in the morning, and I'm also having bread omelette, and I also have khichdi in the morning. So the first meal I keep it heavy because I get the rest of the day to move around and process the food. And the second meal I'm making sure that it's a salad, with a little bit of curd. Curd is really important because it's a probiotic, so ensure that you're having curd. In between the two meals, I have a glass of juice, maybe an orange juice or a beetroot juice or carrot juice. And in the salads, I'm mostly having everything green, capsicums with a little bit of cottage cheese, and I toast it in the ghee, or you can also use olive oil, and have it along with curd and a cucumber, and maybe a plate of fruit. So you can opt to go for a salad, or you can opt to go for a fruit plate. And then in between, like at the time of high tea, you can have certain nuts like cashews and almonds. Soak them in the water, don't have it and chew it properly. That's really important. So I'm having that, maybe with a fruit or something, or maybe with some dates, because it increases your hemoglobin. And in the evening I plan to have soups. So have some soup and try and sleep off by like 9:30, 10 o'clock, after you have your supper, like at 7 or 8ish. And if you're feeling too hungry at night, you can opt for some salad along with your soup, or maybe an egg or something, a boiled egg. That might really help. Or have a couple of digestive cookies, or some snack like puffed rice, roasted puffed rice, or popcorns or something like that. Have a little bit of that, and I think that should compensate for the meal. And drink a lot of water. Approximately 10 glasses of water is a must in a day. And do a little bit of walking. I know when you're weak, it's kind of like really difficult to think about. Like, I feel it's really difficult for me to get up and get moving or do something. But then I aim to like maybe fold clothes, or maybe go to the kitchen or make something light for myself, so that keeps me moving. And yeah, I mean, just walk around in the house a little bit. Don't push yourself too hard, it's all good. And talking about gas and stuff, if you have small meals like throughout the day, I think you're not gonna have that problem. But then as soon as you wake up in the morning, make sure first thing that you're doing is, so first thing that I do is I have Kapiva's wheatgrass juice. It's wheatgrass juice is also called green hemoglobin. I mean, it increases the blood RBC count. And the second thing that I do is have lukewarm water with half a lemon, and a little bit of black salt in it, and it kind of like soothes your system down. So do that, and I think you'll be in a good shape. I'm waiting for my third chemo. And hair loss, yes, it's definitely increasing. But like, my hair has become really rough, and if I just say pull it, you just pull your hair and something is there in your hand. So that's how my hair is behaving nowadays. But that's gonna be the story for a few months. So that's okay. That's all right. Your hair will grow back again. So yeah, that's it. So this was the story of my second chemo. I'll keep you posted about the third chemo, and so on and so forth. Thank you.